Hi, my name is Brian Anderson. I'm here to help my client Mariah. We're going to perform a couple of exercises with our foam roller here, and I'm going to actually take her through a couple of steps of the foam rolling of your calf, and then also we're going to move on to the adductor because that can assist with some of the issues that you've been experiencing with the pains and the hip, stiffness of the hip, as well as limited range of motion, limping with the legs. And then also we're going to move on to the actual piriformis to do those three exercises, so that way we can go ahead and help to maybe alleviate some pain and give you a little bit more movement and flexibility in that hip area as well as the legs. What we're going to do first is we're going to do the foam roller for the calf. So the first thing that we're going to do is we're going to go ahead and have you position yourself. Go ahead and sit on the floor and with your back straight and your legs out. What we're going to do is we're going to place the foam roller about midway up her calf, and then we're going to take the opposite leg and then cross over. And what's going to happen is as you foam roll, once you find one of those tender locations, you'll be holding it for about 30 seconds, and you'll be lifting the butt off the ground and then holding yourself suspended. This way, this pushes additional pressure in the location of the adhesion, and essentially will help with loosening it up. And this is very beneficial for people who do running and have shoes with an elevated heel. And then after that, what we'll also do is these can actually assist with like reducing injury as well as reducing swelling in areas. So first thing we're going to do is we're going to find the first adhesion. So you're going to just creep up with your hands. So you're just going to kind of move back and forth with it until you find a location. And right there, perfect. I see it on the face. You may want to bring those hands a little bit forward, so that way or is that a good position to support yourself? You feel like that's supportive? Okay, good. Yes, and then just try to focus on that location. Just try to remember that it is gonna hurt, but after about 30 seconds, the discomfort will go away. At that point, you're gonna stick your butt on the ground again, and then scoot till you find it. But just make sure you keep that leg straight, because that's where you're gonna feel that tensing and that tenderness. You're doing great, by the way. How's it feel? How's the discomfort feel? Still going away a little bit. Yeah. Okay, let's move on to the next location. Go ahead and slide a little bit, either forward or backwards, but just make sure you do it slowly, just so you can find that. And now we repeat. Perfect. So you feel that tenderness. And this is great because you are keeping yourself elevated. You're also utilizing this, and you can feel your foot will just sporadically kind of move every now and then you'll feel the release, and that's when you can move on to the next. And that's great. How are you feeling? How's the back feeling? Just try to make sure you keep your back straight, and your arms are going to get a little sore. Perfect. Okay, well, let's go ahead and have you, that's essentially what we do, and then we swap to the other side. And I don't know if you can feel it. You need some assistance up. Yep. So this is actually going to help to reduce the pain as well as help to lengthen the muscles that would allow for less injury and less inflammation. So next, we're going to go ahead and do the foam roll for the piriformis. And the way we're going to first do this is you'll go ahead and sit on the foam roller in the hip, on the posterior hip. And then what's going to happen is you're going to cross one of your legs over the knee. So then at that point, you're going to use the opposite hand to hold that knee. You're going to lean into the foam roller while you're supporting yourself. And you're going to just roll the posterior hip until you find those tender areas. And then we'll hold them for 30 seconds. 30 to 60 seconds. And this will help with relieving any type of like the piriformis syndrome is one thing that they say that this assists with quite a bit. And that's where you have essentially pressure on your sciatic nerve. The piriformis syndrome can actually lead to pains in the buttocks and lower leg. Also, with the hips, it causes issue with the adductors, the hip flexors, and the internal rotation. So what we're shooting for here is first to relieve a little bit of that stress. Okay, so let's go ahead and do the piriformis foam roller. So what we're going to do is we're going to go ahead and have you sit on the foam roller and try to position it on your posterior piriformis, which is a little bit like on the side. And what you're going to do now is you're going to, since we're doing the right side, you're going to cross your right leg across your knee, and then you're going to grip it with the opposite hand. And you'll bring that hand a little bit closer so you get a good support. And then try to just lean into that and then roll it until you get to the point of where you feel that tenderness, and slowly do it just so you can be like, okay, that's the spot. Because we both know you can feel it no matter what. You feel the pressure, but when you get to that spot, you can feel that spot. And just hold it for 30 seconds. Just make sure that try not to lean the head too much. Just try to keep everything as straight as you can, but then just lean into the hip. Perfect. And we'll go ahead and hold it for a little bit longer. Yeah, so this is going to actually help with, like once you get all those areas and you kind of roll over it, it's going to help with quite a few of the hip issues that you've seen, as well as I know that you blimped around for a little bit. That's no joke. I felt that pain, but it was in my knees, but hips would be so much worse. All right, looks great. I think. See, as you're rolling slowly, that you can find the location of the tenderness. All right, you're good to go. That's perfect. I'll help you up, make sure that. Okay. All right, so now we're going to move on to the adductor, the hip adductors. So essentially, these are going to be the ones that are actually going to benefit. I mean, these are the muscles here that are utilized for the frontal plane motion out to the side. And what's going to happen is that this consists of about 6 muscles or so that are attached from like short to medium to long connections on your leg, as well for the hip. And what's going to happen is that these muscles right here are utilized to stabilize the sagittal plane as well as the transverse, so your rotations as well. So the idea about this is to kind of relieve those muscles there on the inside. So what we're going to do is when we go to lay down onto your face, and you're going to straddle your leg up like you're wrapping around a pillow or so, and you're going to just flex that and then place the foam roller on your thigh, and you're going to have to actually utilize and stabilize yourself to move around, but this leg is going to stay on the floor. So most of the pressure is going to be right around this area here where the foam roller is at, and we're just going to look for those adhesions. Majority of it's going to be within the mid to the upper thigh, so that's what we're going to shoot for. All right, let's go ahead and have you lay face down. And I will pull this out of the way so you can get positioned the way you want. And which side would you like to work on? Do you want to do the right side? Okay, so go ahead and lift that leg up like you're going to, perfect. And you're going to keep that tension like this with the leg out like that, perfect. And then what you're going to do, you're just going to roll going. Go ahead and find your adhesions, and yeah, perfect. Then you're going to hold that for about 30 seconds or so, and then we're going to slowly move it up and down. Don't go too far up the hip though. I mean up the thigh. You just want to at the point where you're probably good right about there to come back down, but we'll hold that little position for a little bit. just so we can see this, so you can feel how this goes. And then after that, we can proceed to the other side, just like, how's that feel? All right.
Good spot.
Perfect. Yeah, go ahead and roll it back. And try not to rest that foot on the ground. Just a little bit higher. Just keep it nice and tense. All right. There you go. I think we'll be good to go. That looks great. Okay. All right. So by doing those foam rolling techniques, we can kind of essentially help to reduce any injuries as well as improve mobility. It also can assist with a little bit of flexibility. And I think the best part is reducing additional pain and inflammation in areas. So, have any questions or?
No.
All right. Well, thank you for your time.